Hi everyone, my name is Sydney Dalmagrath. I'm the project manager for the Better Nights, Better Days study. We'd like to thank you all for joining us for our first Facebook Live presentation in our series of webinars on sleep in children with neurodevelopmental disorders. The series will be taking place between November 2018 and January 2019. And today, Dr. Isabel Smith will be speaking about sleep and autism spectrum disorder. So welcome, Dr. Smith.
Thanks, Sydney, and thanks everyone for joining us. As Sydney mentioned, I'm going to be talking about sleep in children with autism spectrum disorder. I'm Isabel Smith. I'm a clinical psychologist from Dalhousie University and the IWK Health Center in Halifax, and I'm the Joan and Jack Craig Chair in Autism Research. So I specialize in kids with autism spectrum disorder, or ASD. So the plan today is to talk to you a very little bit about sleep in general and sleep in kids, then focus a little more on what might be different about the sleep of children with autism spectrum disorder, a little bit about how we might go about treating sleep problems in kids with ASD, and we'll have a little time for question and answer if there are any questions, and we look forward to that. So in terms of just some very basic information about sleep, we don't really know why we need sleep. We know that it's a critical function that our brains carry out. We've come a long way from the belief that, sleep was sort of the absence of thinking or the absence of behavior. In fact, the brain is pretty active during sleep, and we need sleep. It's important for things like learning and memory, and it seems to serve some restorative functions as well. And, this is an area of lots of research, but I think that the key thing in terms of thinking about sleep and kids is that it's a necessary function for our brains and our bodies. So why do we get sleepy? There are at least two different processes going on that make us sleepy. One is the idea of the circadian clock. So this is a brain-based mechanism that regulates, when and how long we sleep. So there is a natural rhythm, as most of us are pretty aware, that our bodies follow. The circadian clock is roughly a 24-hour cycle, because circadian actually means about a day. So that's one brain-based process that regulates our sleeping and waking. Another process that is important to think about is sleep pressure. So this is the idea that we build up a need for sleep. And think of it the same way as being hungry. When we're hungry, we need to eat. When we're tired, we need to sleep. It's the same sort of bodily function. And sleep pressure regulates how long we sleep, how deeply we sleep. The more pressure there is, the longer we're going to sleep and the more deeply. Most of us are aware that sleep isn't just one sort of steady state all night, that there are phases within the night in terms of how our sleep is organized. I think a lot of people have heard the term rapid eye movement sleep. So that's a phase of sleep in which, when people who have dogs often notice that, their dogs are twitching and maybe dreaming about chasing the rabbit. So rapid eye movement sleep is a phase in which we dream. It's about a quarter of our total sleep time, and it goes a number of episodes per night. Rapid eye movement sleep seems to be particularly important for learning and for consolidating our memories. So we remember things better if we get sleep, a good sleep after the event or the information that we're trying to recall, which is one of the reasons why cramming for exams and losing sleep isn't a great idea. The other phase of sleep is non-REM sleep. It's a larger proportion of our total sleep, and its function seems to be more about restoring bodily functions. But again, the reasons why we sleep are not super well understood, but we know that we need both of these kinds of sleep. These two different kinds of sleep, non-REM and REM, alternate through the night. So they go in cycles of about 90 to 100 minutes. And so in that cycle, it matters when you wake up. If you wake up in the middle of a cycle, you're more likely to be sort of disoriented and fuzzy than if you go through a whole cycle. So after each cycle, you briefly arouse and then return to sleep. The early phases of sleep are mostly non-REM and later are mostly REM. So dreaming tends to occur a little later in the night. But you need to think about cycles when you're thinking about children's sleep, because it is important to think about, where in a cycle their sleep might be getting disrupted. How much sleep do children need? Well, that's a question that has been examined closely recently by a body called the Sleep Foundation. And this figure shows roughly the amount of sleep in hours per night that children of different ages need. So our need for sleep does decrease with development from about 11 to 14 hours a day in toddlers, then gradually decreasing so that in teenagers, 8 to 10 hours a week. But I think all of you who are parents will recognize that most teenagers are not getting 8 to 10 hours of sleep. But these are the numbers that would be recommended in order to sort of produce optimal performance for kids in terms of their behavior and their learning and their happiness. So what happens when you don't get enough sleep? I think, again, all of us are aware that we're all sleeping less than ever before. Sleep time is at an all-time low historically. Most of us who are working adults don't get enough sleep. Most of our kids don't get enough sleep. So when you're not getting enough sleep, that could constitute a sleep disorder or a sleep problem. When we look at standard definitions of sleep problems, about a quarter of typically developing children are not getting enough sleep to the extent that we would consider it a problem. When we talk about children with neurodevelopmental disorders, including kids with ASD, 3/4 of those children are not experiencing good quality sleep and enough sleep. The most common form of sleep disorder we'll call behavioral insomnia, and we'll talk about some of the symptoms of those in a moment. But it basically is just the most common form of loss of sleep for kids. And the important thing to keep in mind, and again, those who are parents know this, children's sleep problems affect the whole family. So if an adult isn't sleeping, that's on them. If a child isn't sleeping, typically the adult isn't sleeping, the other kids in the family aren't sleeping, and so there are repercussions for everybody in the family. What are the consequences of not getting enough sleep? Well, there's good research demonstrating that one of the things that's most significantly affected is cognition and learning. So in particular, attention and memory are severely affected by lack of sleep. So I think we're all aware of that in the short term. If we don't get a good sleep, it's harder to stay alert, stay attentive. It's harder to learn new information. Chronic sleep loss has an even bigger effect. Another effect of not enough sleep is on social and emotional behavioral functioning. So the kind of thing we see there is lack of sleep produces reduced ability to regulate one's emotions, regulate one's behavior. And for kids, the inability to regulate one's emotions and behavior can result in not feeling good about oneself or lower self-esteem. So there's a set of problems, that physical and psychological problems that can result from not getting enough sleep. On the physical side, there's increasingly evidence that lack of sleep contributes to obesity, even beyond the effects of exercise or lack of exercise. And there are other health problems as well, but obesity is one of the ones that's being really prominently focused on lately. So what about children with autism spectrum disorder, who are the focus of our talk today? Well, in these kids, sleep problems are more likely. So they are, probably sort of 4 times more common than in kids with typical development. So behavioral insomnia is quite common, and it could be any combination of these features. Taking too long to get to sleep, waking more often or for longer periods during the night, so being unable to settle back to sleep during the night when you wake, waking up too early in the morning, in fact, waking up sometimes when we would still say it was night, and then shorter sleep overall, which obviously can be a consequence of all of those other problems. So those features together would constitute behavioral insomnia when they're affecting a child's functioning. The other thing about kids with ASD is it could be that their sleep problems are somewhat more persistent when they go untreated, because as we know, kids with autism spectrum disorder tend to sort of get stuck in routines a little more. Their behavior patterns tend to be a little harder to nudge, and so their sleep problems may also be a little harder to nudge along toward a more typical pattern. Why do we think there are more sleep problems in children with autism spectrum disorder? Well, it's possible that because this is a neurodevelopmental disorder, that the brain basis of autism spectrum disorder may also affect the biology of sleep. There's a suggestion that there are differences in how that biological clock, that circadian clock, is regulated in autism. There may be some differences in how sleep is organized, such that it may be harder to fall asleep. Some suggestion that maybe less non-REM sleep overall, so sort of less satisfying sleep. And sleep may be lighter, so you may not enter as deep a phase of sleep. Again, those things may be true in some, and not necessarily all children with autism spectrum disorder. The important point to keep in mind, though, is more sleep problems or differences in sleep patterns doesn't mean that sleep problems are untreatable in kids with autism spectrum disorder. So that's a key message for us, that the ways that we treat sleep problems are going to be similar. Also, just thinking about children with ASD and why sleep problems may have more impact is that those areas that are affected by poor sleep may also be already a difficulty for a child with autism. So if you think about, typical effects of autism spectrum disorder, differences in ability to regulate emotion and behavior, perhaps some impulsivity, differences in attention, perhaps being over-focused in one's attention and not being able to move attention flexibly around. If those areas are already a difficulty for a child with autism spectrum disorder, and then you add the effects of poor sleep on top of that, you can see how the situation may become even worse. There's also strong evidence that sleep problems will worsen the autism spectrum symptoms that a child shows, in addition to possibly to their other symptoms. So we know that anxiety is a common co-occurring problem for children who have autism, and sleep problems can worsen both the autism symptoms and the anxiety symptoms. Another thing to think about for children with autism spectrum disorder, particularly young kids who may be in intensive forms of therapy, is that sleeplessness or being overtired may interfere with the effectiveness of therapies. And that makes sense when you think about the effects on learning. So the point of therapy is to teach new skills. If your ability to learn is affected by lack of sleep, then the therapy is potentially going to be less effective. So let's talk a little bit about treating sleep problems. So if you think about treatment as having being a sort of hierarchy of sort of the easiest, most innocuous things to try to the most significant kinds of interventions, the first line of attack in treating a sleep problem is just information and education. So the kind of information that we've been talking about already, in which you just become acquainted with what sleep is, what are the typical patterns of sleep. That's a form of intervention, to be mindful of what the potential effects are of poor sleep, and thinking about what is sleep and why do we need to promote good sleep. The next step in a hierarchy of treatment would be a focus on healthy sleep practices, and we'll talk more about that in a moment. But the first line of intervention is just to ensure that the child and family are approaching bedtime and the time to sleep in a systematic way that's likely to promote good sleep. And as I said, we'll get to that in a moment. The next line would be sort of beyond what we would typically have to do for other kids, and that's to be thinking about explicitly putting in place some behavioral strategies to promote good sleep practices and sleep related skills. So it's a little more than just healthy routines. It's a little more specific focus on aspects of behavior that may facilitate a good sleep. At the top of this pyramid is medication. So we're not going to talk very much about that because I am not a physician, so I'm not the right person to give advice about medication. However, what I will tell you, just to comment on this and then get it out of the way, is that there isn't actually much research support in typically developing children, much less in children with autism spectrum disorder, about the effectiveness of medications as a sleep treatment. There's very little support for this as a strategy, but regardless of the fact that there's very little evidence supporting it, children with autism spectrum disorder are more likely to be prescribed medication for their sleep problems than typically developing children, which should be a concern. Mostly because most of the medications that are used to treat sleep problems have side effects, and those side effects may actually be disruptive to the child and family. And so it's worth sort of weighing the consequences of using medication that may produce side effects that then themselves have to be treated. Most families are aware that melatonin is a possible intervention, sort of non-medication, but sort of pharmacological intervention for sleep in kids with neurodevelopmental disorders or others. It isn't prescription medication, which makes it more acceptable to many families. Melatonin is actually a hormone that's naturally associated with sleep onset. So in its essence, one is just taking extra melatonin. It may improve time to fall asleep. It doesn't always improve the time spent asleep once you've fallen asleep. So depending on what the problem is, whether it's restricted to falling asleep or whether it has to do with night waking, melatonin may or may not be helpful. It is generally safe. There are some mild side effects are possible. And one of the things that families often find is that they may find melatonin is initially effective, but becomes less effective over time. And so the dose may need to be increased. So that's all I'm going to say about medication. But it is important to know what that situation is for kids with ASD. So just thinking about healthy sleep practices, the most important of the sort of healthy sleep practices is having a consistent routine in relation to bedtime. This is challenging for some families to do, but it's really important to think about bedtime being consistent, particularly even across weekdays and weekends. Many of us look forward to sleeping differently on weekends than we do on weeknights, but for kids it really is important to have that consistency, ideally within about 30 minutes in terms of bedtime on school nights or weeknights and weekends. The most straightforward way to think about bedtime is to base it on the time that the child needs to get up and then counting backwards for the number of hours that would be appropriate for a child of that age. Obviously, there are big individual differences in sleep needs, and so you have to adjust based on that, but that's the sort of rule of thumb, is to start with when do you need to get up, and then when do you need to go to bed to get your appropriate sleep before you need to wake. It's important as part of a healthy sleep routine to have winding down activities. So most of it, again, this is common sense, would not want kids to get all fired up right before bedtime. You want them to be in a more relaxed state. So you need to think about what activities for your child are going to result in winding down or being calmer. Going to bed when tired is important because of what we mentioned earlier about sleep pressure. Sleep pressure builds up during the day just as hunger builds up if you haven't eaten. And if you are active during the day and then calming down at night, there should be pressure to go to sleep if your body is tired. Before bed, it is important to avoid video games, TV, exercise, large meals, caffeinated products, all of those for a variety of reasons, and we can talk a little more about that. But those are all part of a healthy sleep routine, is avoiding those things before bedtime. The bedroom, bed and the surrounding environment should be a part of a healthy sleep practice. The bed should be comfortable, temperature should be moderate on the cool side rather than the warm side, quiet and dark room. It also is important, and we'll mention this again, to associate the bedroom with sleep. So bedroom isn't necessarily a playroom, it's the place that you go to sleep. And again, not all families can manage that, but this would be the ideal. This is a nice little mnemonic from Dr. Corcom's lab to help both clinicians and families remember sort of the key elements of a sleep routine, the ABCs of sleeping. So you can see on the slide behind me that sleep should be age appropriate in terms of the bedtime. The bedtimes and wake times should be consistent. Schedules and routines are important. The location of sleep is important. Exercise and diet. No electronics in the bedroom. Positivity and relaxation, or a calm pre-bedtime routine. Independence while falling asleep is a really important thing to keep in mind. And for those things to happen, needs need to be met during the day. So the child's needs for attention and so on should be met during the day, so they're not getting your attention at bedtime. And all of those things go together to make great sleep. So for children with autism spectrum disorder, you might need to tweak some elements of those ABCs a little bit. So in particular for kids with autism spectrum disorder, consistency can go a little overboard. And we know that these are children who tend to really like their routines, but also sometimes to get a bit stuck in routines. So what many families try to do is mix it up a little bit. They introduce just enough variability that the child is not too thrown off when a routine has to be disrupted. So really what you're doing then is trying to build in some opportunities to teach flexibility. So little variations in routine, so the basic routine stays the same, but maybe you mix it up just a little bit in order that any disruption isn't a problem. Exercise during the day can be a challenge for some kids with autism spectrum disorder because not all kids with autism spectrum disorder have great motor skills or love competitive activities. So it is important to think about kids getting exercise, but getting exercise in a way that works for them. So, for many kids that might be non-competitive physical activities like martial arts or yoga, just family walks, anything that, gets the child out and moving and helping to build up sleep pressure to make for a better sleep. The no electronics before bedtime rule is a really tough one for a lot of families with ASD because we all know lots of kids with autism spectrum disorder who are pretty attached to their electronics. So it's a really important part of establishing good sleep routines to stop the use of those tablets, laptops, phones, video games before bedtime, at least 30 minutes before bedtime, ideally. And you may have to work up to that. You may have to stop for shorter periods and then build up to the 30 minutes or more until you find a time that helps your child. But it's well established that the light from electronic screens is a disruptor of sleep. It also, for kids with autism, playing video games and so on can get them quite cranked up and not in an ideal state for relaxing and falling to sleep either. Some other ABC tweaks that you might want to think about for a child with autism spectrum disorder is this idea of remaining positive and meeting the child's needs during the day. It is really important that you have times during the day when the child gets your full attention and can talk to you or play with you about the things that matter to him or her, so that bedtime doesn't become the time when they're fighting for your attention and using that as a way to prevent going to bed. Independence while falling asleep is one of the things that can be a challenge for some kids with autism spectrum disorder and their families. Again, keeping in mind that when the child has sleep problems, so do the parents. Parents are desperate just to have the child go to sleep and will sometimes resort to things like lying down with the child to help them sleep. Think of falling asleep on one's own as a skill. It's one of the independent skills that you want your child to learn. It is developmentally appropriate for infants and toddlers to learn to fall asleep by themselves. Co-sleeping is something that you may want to have in your family when your child is very young, but there comes a point at which falling asleep is a skill that most children need to learn. And once it's established, co-sleeping is established, it's a hard one to break for some children with autism spectrum disorder. So thinking again at the next level of interventions beyond healthy sleep practices, we're talking about behavioral strategies. And I've grouped these a little bit to 3 that I'm going to talk about very briefly, and then 3 that I'm not going to get into that are a little more technical. So the first 3 behavioral strategies really are sort of tweaks of the ABCs again. So when we're using these behavioral strategies for a child with autism spectrum disorder, some of the things you want to keep in mind up front are that all of the talking that you might do in association with trying to implement a strategy needs to be adapted to the child's language level. So communication, using the strategies that work in other aspects of the child's life. So right language level, short sentences, simple ideas, visual supports if needed, social stories or scripts may be helpful in the context of setting up bedroom routines, as they can be in other aspects of a child's life. For a child with autism spectrum disorder, you might need to have a good plan for managing if the child resists a strategy you're trying to put in place. So again, just thinking ahead about what could go wrong, how am I going to address that, is going to be really important. Behavioral strategies require a step-by-step approach And for a child with autism, you may need to spend a little more time in each step than you might for other kids, but that's not a reason to give up. It just means you need to be as persistent as the child is. For kids with autism spectrum disorder, choosing the right kinds of rewards can be really important, because again, think about the fact that you're not going to reward a bedtime routine with time on a video before bed. That's not going to be the right kind of reward. So thinking about what rewards are going to be appropriate for rewarding good sleep is going to be important. And another thing just to think about is, you know, when you've tried strategies, behavioral strategies, and you're running into barriers or obstacles, think about what professional support you might seek. Typically for sleep problems, it's going to be, for behavioral strategies, it's going to be somebody like a psychologist or a behavior analyst, but there are other professionals in healthcare who might be able to assist as well. Sometimes occupational therapists or a pediatrician who specializes in managing sleep problems might be the right person, depending on your community. So talking again briefly about some of these general strategies, relaxation is just as it would be with anyone else. You can use techniques to promote a more relaxed approach, to creating a calm environment at bedtime. Again, what you're doing is teaching the child to calm themselves down. And the same things work for kids with autism spectrum disorder as work for other kids or even adults. Deep breathing, which in kids we often call belly breathing, guided imagery, sort of imagining a relaxing scene and going through that step by step, or a strategy called progressive muscle relaxation may work for a child with ASD. Again, they need to be adjusted to the child's cognitive and language abilities, and you also need to think through the steps and how you're going to implement those steps carefully, step by step, with the child at a pace that puts those things well in place. Stimulus control is just a fancy way of saying make the bedroom and the bed and that environment cues for going to sleep. So the cool or intermediate temperature, darkened room, you may need to use blackout curtains, particularly, you know, on summer nights, is important. No using the tablet, TV, phone, laptop in the bedroom. And again, the picture shows the child with the light shining on his face. That light on the face from that tablet is a sleep reducer. Positive reinforcement should be a very familiar strategy for most parents, certainly, and many parents of children with autism spectrum disorder who have implemented some kind of behavior intervention before. The basic idea is the same as with any other behavior. You reward what you want to see because that increases the chances that you'll see that behavior more often. You focus on the positive behavior you want to see. To the extent you can, you ignore negative behavior. You avoid rewarding behavior you want to discourage. So if you've got a child who whines about bedtime, you ignore that. You don't reward it. You reward the going to bed part. I mentioned choosing rewards that matter to your child, which may be a little more challenging for some kids with autism spectrum disorder. You want to reward as soon as possible, which may, if you're rewarding a whole good night of sleep, be first thing in the morning. So you need to think about a reward that would be meaningful to the child in the morning. Perhaps breakfast, favorite breakfast cereal, favorite breakfast, or some other kind of treat in the morning, or some kind of activity with you in the morning. It might be very helpful for a child with autism spectrum disorder to keep track of rewards with some kind of visual system. So one kind of visual system is a sleep chart, and this is just a basic example of a sleep chart that sets out a number of steps that the child needs to follow. So following the bedtime routine without resisting, going to sleep without calling to parents or getting out of bed. And the idea here would you would keep track of which of those behaviors the child was able to successfully show each night. And then you would give rewards based on being able to show those behaviors. And again, this is just an example of a child who might be earning points toward activities that they want to do, or for actual cash to buy something that they want. There are lots of different ways to use charts and lots of resources out there that you can show you how to do that well. So key messages, I think, as takeaways, it's important to keep in mind that individual sleep patterns vary, both for all of us, but also for children with autism spectrum disorder. So there is no absolutely one right bedtime, wake up time, but you want to ensure that your child is getting enough sleep so that they're healthy and happy. We all need good sleep, quantity and quality. So it's not just the right amount of sleep, it's that we're sleeping comfortably and in the right environment. The first step in treating sleep problems is setting up good sleep habits. So remember those ABCs of sleeping. And remember that the sleep problems of children with ASD can be treated, that the methods are the same as for typically developing children. You need to tweak them, though, to take into account the behavior of your particular child and your child's skills and abilities and other difficulties. We know that we've had success when treating sleep problems, when parents are setting expectations and limitations that are appropriate for the child's age and ability, and that the child is learning to fall asleep, stay asleep, go back to sleep independently, and waking up refreshed in the morning. One excellent resource for families who have children with autism spectrum disorder is the sleep toolkit from Autism Speaks, an American organization. So if you go to the Autism Speaks website, you'll find a variety of toolkits. The sleep toolkit is one of them, and that's got lots of great suggestions in it. Another, just to think about what for kids who need to learn relaxation strategies, this is a book by Jean Groden and her colleagues, a manual for teaching relaxation to children with autism or children with other developmental disabilities that has some great strategies that may be good things to teach even before you try to implement them as part of a sleep routine. And the last thing I want to tell you about is a research opportunity that's coming up very soon, early in 2019, for families who have children with autism spectrum disorder, who have insomnia, who have sleep problems. This is a web-based intervention, Better Nights, Better Days for children with neurodevelopmental disorders. This is a program developed by experts in sleep and neurodevelopmental disorders for families to implement with their children as part of a research trial. It's delivered entirely online with all the support you need to implement these strategies with your child. So it will teach you the kinds of strategies I mentioned that we didn't have time to go into. And we're hoping that lots of families will be willing to try out this intervention with us, give us their feedback, and ideally we'll discover then whether it's going to be the right answer for a lot of families of Canadian kids with autism spectrum disorder. So it looks as though there may be some questions. And pardon me while I peer at the questions. Can we get a copy of the PDF for the sleep reward chart? I'm sure we can send the sleep reward chart as a separate PDF. Were you able to post that, Sydney? The PDF of the slides, the video itself will remain active, and I think people will be able to look at it. But the sleep chart, I think, could be linked so that you can download that separately. You should also be aware that lots of workbooks for kids' sleep problems or other behavioral intervention workbooks would give examples of sleep charts as well, and that the targets, the behavior you want to change, that you might be using a sleep chart for, has to be individualized, because there may be some things that your child already does beautifully within a sleep routine, and you want to make sure that's acknowledged, but the points that they're earning are for the things that they find harder that take a little more effort. So I'm just looking at the screen to see if there are any other questions, and I don't see any. So I think we're going to hand over to Sydney then, and thank you for your attention.
Thank you, Dr. Smith, and thank you all for tuning in. If you're watching this live or as a recording, we hope you'll be able to join us for our upcoming series of presentations in the coming months as well. We'll be posting our full schedule and dates on our Better Nights, Better Days Facebook page, so stay tuned.